Can you tell me who you are?
My name is Rachel Harding.
And what do you do for Leicestershire Partnership Trust?
I'm a community nurse. I've been in this role for 14 years in this team.
How come you've been with us for 14 years?
I love the job. I'm local. I live in Market Harborough. But the job is so varied. I come from a hospital background. I worked in a hospital for 5 years. But I always knew I wanted to be a community nurse from when I started my nurse training. And I can't see myself doing anything different because I enjoy it so much. No 2 days are the same. And patients, we build up good relationships with our patients. We have an amazing team here in Market Harborough, Kibworth, Oby and Wigston. And it's just the variety of the job that I love.
Is there a best part to the job?
There's lots of best parts. I work in an amazing team. We're all very supportive of each other. We always help each other out. We have a really good management structure here with very supportive managers. But also the patient's feedback makes your job worthwhile. It's the job satisfaction for me. When a patient tells you that you've made a really positive impact on their life from just treating a wound, but that wound has been affecting them in such a detrimental way for so long, and it's nice to see it get better and they can get on with their lives. Just recently I've been looking after a lady with a severe leg ulcer, and she chose to tell me while I was looking after her leg that I had a very special gift, and she went on to say that I made her feel as though she was the only patient on my list that day, and that I've made such a positive impact to her life. And that, you know, that touched home. It's comments like that that make you realise why you become a nurse, and it meant a lot more than she'll know. It made a big difference to my day that day.
And how often do you get positive feedback like that?
Every day, really. Everyone's so thankful for what we do, and they're always thanking us, and we do get a lot of thank you cards and letters from patients thanking us for the high standards of care and the empathy that we've showed them throughout that care, and the professionalism that we've shown them too. We cover a whole range of patients, so we administer insulin for patients that can't do it for any reason themselves. We look after the leg ulcer patients, so we're commissioned to properly assess and apply compression bandages to leg ulcer patients, and we run a clinic, and I'm heavily involved in that. That's my interest, leg ulcers. We deal with surgical wounds, so on discharge we take on the acute care of the surgical wound, but then signpost them on to more relevant services, so once they're up and about they can go to their surgery and have their wounds dressed with an appointment. A massive part of our job is end-of-life care, so it's giving the people in the community the choice of where they wish to die, and we're heavily involved in enabling people to die at home peacefully and with dignity with their family around, and that is in itself rewarding because you've helped that person to have a good death. We care for catheters, male, female catheters. We have a catheter clinic here as well. So there's a whole variety, and we're going through a transitional change, so we are having opportunities to improve our skills and learn new skills, because the teams are coming together in a more integrated way of working. So we're now going to be trained up to do IV antibiotics. Other nurses are going to be trained up to do compression and Dopplers. So it's a massive, interesting job to come into, and that's why I love it so much.
You've previously worked in hospitals.
Yes.
What makes you prefer working in the community?
The autonomy and the independence and the responsibility that it gives you as well, and the fact that you might be the only person that a patient sees all day.
What would you say to a newly qualified nurse who's considering her options, his or her options? What would you say about a community job?
The first thing I'd say is don't be scared to come out onto the community. We've had lots of newly qualified nurses come into our team, and there's a really good induction programme where you are looked after and you learn your skills in that induction period, and you are well supported. I think people are scared to come straight out into the community, but there's no need to be, because we're all here to help. And even now, as a qualified nurse of 20 years, sometimes I have to ask for help from my colleagues because we might not have seen something before. So it's a huge opportunity to gain a lot of skills and in a lot of areas, and I would encourage people to come out onto the community.
Okay. And you mentioned that you live locally. What's it like to live in the Harborough area?
It's a lovely town. The surrounding area is lovely. We cover quite a large area, but it's rural. The patients are really nice. There's lots of facilities in Market Harbour. We've got the station that's local. We've got a really good bus service. We've got nice shops. Everyone's really friendly. You're not scared to walk around on your own in Market Harbour or anywhere around here, really. It's quite a central job and place. So yeah, it's a nice place. You have to care, and you have to want to care for people and look after people in an holistic manner. Not just go in and do a dressing and walk out. We're looking at people and their whole life, and showing empathy and treating everyone as an individual. No two people are the same, so what's important for one person isn't for another. And it's about not judging, not telling people how they need to live, but giving them the knowledge to maybe change slightly and improve their lives themselves. But caring is the most important thing in nursing. We need good nurses. It's a great career for anybody of any age. I started my training at 24, and haven't looked back really. So yeah, if you are thinking about being a nurse, I would definitely go and do it, because it is so rewarding.